Thank you all for being here tonight, for taking the time to join us at the vaccination conversation. I want to start off the evening by thanking Katrine Helmrich, who came up with the idea of holding a seminar about the issue of vaccination, looking at the other side of the story. It was because of her great idea that the vaccination conversation event came into being. Unfortunately, she couldn't make it tonight, but we are very grateful for her input. Before we begin, I just want to give some information about the toilets and some drinking water. So if you go out into the foyer and you turn that way, there are the toilets. And over in the foyer, there is a water dispenser in the foyer, and there are disposable cups nearby for you to use. We would appreciate it if you could wait for the transition periods between when the speakers are transitioning before you go and get some water, if that's okay. And if you need to step out to go to the toilet, that's fine. Please note that this event is being recorded and copies will be made available after the event. We kindly ask that audience members do not film or record the event themselves. Thank you for respecting this request. Speaking of recording the event, we'd like to sincerely thank the Australian Vaccination Risks Network, the AVN, for generously sponsoring the recording of this event. The AVN is a volunteer-run, not-for-profit organisation that has supported informed health choice for decades, while also providing support and a voice for people and families affected by vaccine injury and death. If you'd like to learn more about this important organisation or support their efforts, please visit avn.org.au. Now I'd like to acknowledge the speakers. Sorry, my hair's getting in the way. Over the past few months, it's been a privilege to work alongside these extraordinary people, Dr. Philip Altman, Dr. Julie Wileman and Wendy Daniel. They have shown courage, integrity and commitment to open dialogue and they have brought this vaccination conversation to life. These remarkable people have given their time freely, and Wendy and Philip have travelled for hours to get here tonight. So in a time when questioning government and medical policy can come at significant personal and professional cost, each of these speakers has shown immense bravery in being willing to publicly discuss perspectives that are often overlooked or challenged. Dr. Judy Wileman, in particular, has endured years of public criticism, censorship and personal attacks, simply for questioning policy and advocating for open scientific debate. Despite this, she has remained steadfast in her commitment to raising questions she believes deserves scrutiny. I want to thank you, Philip, Judy and Wendy, for your generosity, your courage and your willingness to stand in your convictions, even when the path has not been easy. It has been an honour working with you to help bring this important event together, and your contributions are deeply appreciated. Out of respect for all speakers and attendees, we ask that presentations are not interrupted. If you have questions, concerns or comments during a speaker's presentation, please save them for the question and answer session, which is happening after their presentations, where everyone will have an opportunity to participate respectfully. Thank you for helping us create a safe environment for both speakers and attendees. Today's seminar has been created as a public forum designed to examine transparency, expertise and scrutiny around how vaccines are developed, approved, regulated and integrated into Australia's public health framework. For many years, discussion around vaccines has been seen as very controversial. It often felt difficult, polarised and at times emotionally charged. Some people with genuine questions or concerns about vaccines have felt hesitant to speak openly for fear of being dismissed or labelled as an anti-vaxxer. This emotive term was designed and has been used to silence, shame and shut down legitimate questions. Science has always advanced through questioning, testing, challenging and continual review. Public trust is strengthened, not weakened, when difficult questions can be explored respectfully and transparently. Tonight's event is about hearing expert perspectives that are often censored and ignored by the media, regulatory bodies, the medical establishment and our governments. This important event is about ensuring that ethical governance, scientific integrity and informed public participation remain central to healthcare decision-making. As a society, we continue to see rising rates of chronic illness, allergies and developmental conditions. But the good news is more and more people now believe it's reasonable to ask broader questions about public health trends, environmental influences, medical interventions and how evidence is evaluated. Now it is my great pleasure to introduce one of our keynote speakers. Dr. Philip Altman is one of Australia's most experienced experts in clinical trials and drug regulatory affairs, with more than 4 decades of experience in medicine development, pharmaceutical regulation and clinical research. He has held senior positions with multinational pharmaceutical companies, played a key role in establishing Australia's first contract research organisations and has been involved in more than 100 clinical trials across phases 1 through to 4. Importantly, Dr. Altman has worked closely with the Therapeutic Goods Administration in securing approval for numerous medicines, giving him direct experience and rare insight into how pharmaceutical products are assessed, regulated and brought to market. His expertise spans international pharmaceutical standards, safety testing, clinical efficacy assessment, quality control and regulatory processes. Quite simply, he understands the system from the inside. In addition to his very impressive career, Philip holds a Bachelor of Pharmacology honours, a Masters of Science and a PhD in Drug Development. Dr. Altman's presentation tonight is titled COVID Vaccines, What You Need to Know, All the Facts on the Development, Approval, Clinical Efficacy and Safety of COVID Vaccines and Implications for Other Vaccines. Please join me in warmly welcoming Dr. Philip Altman.
So, over the last 6 years, we should have learned an awful lot. Some of us have learned more than others. We all have a story to tell. And when I was asked to do this presentation, I thought, what would it be about? And I decided after 6 years, and I have 40 minutes to distill some of the most important aspects of what I've learned and what you should know. This presentation is designed to be the basic information that you should have. This seminar is about vaccine education, and many of you know an awful lot, but let me present some information to you. I might be able to fill some gaps. There were lots of people, of course, who came to Canberra to protest the policies of mandatory vaccination. And this wasn't publicized in the media at all. We're still suffering from censorship. That's why seminars like this are so important to get the message out. People like this, like Fauci and others, have been giving you information for the last 5 or 6 years. Just about all that information, I would classify as misinformation. The advice that we've been given has actually come from some of the top world policy makers, from Fauci to Joe Biden himself to the head of the CDC. Some of the statements are, when people are vaccinated, they are not going to get infected. That's wrong. We all now know that that's wrong. Joe Biden, you're not going to get COVID if you have these vaccinations. Wrong. That's wrong. And vaccinated people do not carry the virus and don't get sick. All those statements from the people who controlled world policy on COVID vaccination were clearly wrong. This is another person who helped develop the policy in Australia of mandatory vaccination. She was a senior bureaucrat in Canberra, and she didn't even have a scientific degree. This is an important slide because it really explains much of what went wrong. You're asking yourself, how could we have gone so wrong? How could they have allowed the misinformation to be spread so wide? Why were the decisions so crazy? And there's an explanation for it. The COVID-19 vaccines were not classified in terms of their development as drugs. Let that sink in. They were classified as countermeasures, and they were developed under the total supervision of the U.S. Department of Defense. The usual rules regarding the testing of quality, safety, and efficacy did not apply. And that's the reason why we're seeing what we're seeing today. Let me give you an example. The COVID-19 vaccines, when they were first released by Pfizer and Moderna, were said to be based on 44,000 individuals, roughly, divided into two groups, placebo and active. We were told those vaccines were 95% effective. Most of the people just took the word of the government that that was the case. I'm giving you the facts. That result of 95% effective was not based on 44,000 individuals. It was based on 170 individuals. 162 of those people in the 44,000 developed symptoms of COVID, mild symptoms of COVID, not life-threatening, not severe enough to send you to hospital. They were symptoms like a common cold. 8 of those 44,000 were vaccinated, and they did not show those symptoms. Or they did show the symptoms, and there were 8 of them. So you compare 162 to 8, that's where you get the 170. So the absolute efficacy is less than 1%, not 95%. It's actually 0.88%. The worst part of this was that this was not a secret. If you only looked, the information was actually there. This was a FDA press release, and look at the date. The date is the 11th of December, 2020. And what they said, they actually referred to the 170, but it went over the head of just about everybody. And they said, nor is there evidence that the vaccine prevents transmission of SARS-CoV-2 from person to person. There it is, from the horse's mouth, from the FDA, December 2020. We were told this was just a vaccine. This wasn't a vaccine. This was a form of gene therapy, in that you were being, the people that got these injections were being administered mRNA, which is genetic material. By any definition, this was gene therapy. And furthermore, it was experimental. There was no precedent for this platform, the mRNA vaccine. They did change the definition of a vaccine. The industry ran into some problems because, as we now know, if you're vaccinated with the COVID-19 vaccines, you still get COVID-19. In fact, there are studies that show the more highly vaccinated one is, the more chance there is to get COVID-19. I was in Parliament House the day this paper was released, and one of the authors was a participant in the presentations that we were giving. And the paper showed that from the original 44,000 patient study, if you really looked closely at the data, there were 3.7 times more cardiovascular deaths, that's heart attack and stroke, in the treatment group than the placebo group. And this was not reported by Pfizer. This was a real red flag. This should have been taken to the FDA and discussed. This was a real red flag, but this information was buried. This is another really important point, which many of you might know about. It's about the PCR testing, which was one of the greatest pieces of misinformation in this whole saga. Because the PCR test, as defined by the guy who won the Nobel Prize for inventing the PCR test, said it wasn't diagnostic for disease, especially at the cycle threshold rates that they were applying. They were cranking up the sensitivity of the PCR test to get positive results. And they should never have done that. It was not diagnostic for disease. They were calling people infected when they were not sick and they were not going to get sick. One of the other great pieces of misinformation is the origin of the virus. And of course, there's been some of that in the news in recent times, but there's been a whistleblower from the CIA itself who's now come out and said that the CIA was under great pressure not to admit that the SARS-CoV-2 virus came from the Wuhan lab. But that is now public knowledge. You should also know that APRA, the regulator of all health professionals in this country, wrote a letter to all health professionals, whether they be GPs or physiotherapists or dentists or whatever. This is part of their letter to doctors that basically said, if you do not follow the narrative and the policy of the government, we will chase you down and we may take away your license to practice. That is why when you asked an opinion of your doctor, your GP, about this vaccination, this injection, they could not tell you the truth if they knew it. Some of them didn't know it, but those that did know it weren't even allowed to tell you what their opinion was. Another thing which is really interesting that shocked me was that when I worked in multinationals as a staffer in medical departments, I was never allowed to use one word, and that word was safe. It was actually against the law to claim that any therapeutic was safe. And it's reasonable because all drugs have risks and benefits. No drug is safe. And I was absolutely astounded when I heard that they were calling these things safe. And I mentioned that to a lawyer that I was working with at the time on one of the many cases that I've been involved with. And he said, oh, well, they just changed the law. And I said, what? He said, yeah, look it up. And I did. And they actually did. They actually changed the law to exempt COVID-19 vaccines so that they could be called safe. Here's another bombshell. This is Professor Plotkin. Professor Plotkin is sort of similar, you know the Gray's Anatomy book, you might not know it, but the Gray's Anatomy is the Bible of doctors around the world, right? There is a one volume that says it all, that's constantly referred to by every doctor. Well, this guy, Plotkin, is the godfather of vaccinology, and he wrote the equivalent to Gray's Anatomy. Everyone referred to this guy. And he was testifying under oath in the US in a congressional hearing, and he had to admit that no vaccine has ever been studied long-term against a true placebo. Let that sink in. No vaccine has ever been studied long-term against a true placebo. So there's huge problems here. Now, I come to the next slide, which really is the basis for a lot of the problems that we're facing, in my opinion. And that is, in 2018, the Australian government introduced provisional approval of drugs. Now, a lot of doctors don't know what provisional approval means. The mainstream news media wouldn't have told you. I appeared in court once in a family court matter, and this was after an hour and a half of debate with me sitting outside the court, with the lawyers debating whether or not the court wanted to hear the science. They obviously didn't want to hear the science. But I got to testify, and the first question was from the barrister on the other side, Dr. Altman, don't you agree the COVID-19 vaccines were approved by the TGA? And I said, no. And the lady barrister looked at me and she said, no? Did you say no? And I said, no, because they were only provisionally approved, and there's a huge difference. And with that, I was dismissed from the court. They did not want to hear it, because provisional approval means the drug has not been subjected to the usual safety and efficacy criteria and guidelines in testing. People didn't know that. They were saying that they were approved. At the same time that the government in 2018 introduced provisional approval, they introduced what they call the Black Triangle Scheme. Who knows? Raise your hand if you've ever heard of the Black Triangle Scheme. A smattering of people. You've never heard of it? Most doctors have never heard of it. The Black Triangle Scheme. It's not the black triangle on the upper right. It's the black triangle on the lower right. And it's a little symbol that they introduced to alert doctors to tell them, be careful. We want you to report every single adverse event reported to you by patients or family members. Even if it's been reported before, it's your obligation to do it. And this made sense to me at the time. Because if you're going to introduce a provisional approval system and you don't have the full data set of safety, you need physicians to report adverse drug events as they occur in the real world, which is used by millions of people. It made sense. But did they tell doctors about the Black Triangle Scheme? I personally have not seen any effort on the part of the regulators to advise doctors about the Black Triangle Scheme. And I bet if you go and see your GP and you ask them what does the Black Triangle mean, they wouldn't know. Let me just fill you in. On the right-hand side, don't strain to try and read that, but there is one document that all doctors must read in order to safely and efficiently prescribe any medicine, and that is called the product information. It's a special document, capital P, capital I, product information. It's usually 20, 50 pages long, fine print. Do doctors read this? Not really. The dosage is usually at the end of the document. That's the way it's always been done. But with these vaccines, the dosage was brought at the front of the document, and you can see that the TGA warned doctors that the safety was not fully evaluated. How do you know? you can look. You see the little tiny black triangle on that page? That's all they saw. You think they took notice of that black triangle? No. This is interesting too. This is the plasmid, that is a circular bit of DNA that was used in the manufacture of the COVID vaccines for Moderna and Pfizer. DNA is toxic. If you use it in manufacture, you have to clean it up before the final product is made. The scale-up manufacture and sub-manufacture of these vaccines was really very poorly done. It was done by a lot of people, a lot of subcontractors in record time, and they cut corners. One of the most famous genomic experts in the world, Kevin McKernan, has said the impurities of the DNA is dangerous and can cause cancer. The TGA responded, and they put out a little blurb saying, no, we've analyzed the vaccine vials, and there's nothing to worry about. Unfortunately, they didn't assay it correctly, according to Kevin McKernan. And he says the cancers that are on the rise throughout the world are based, at least in part, due to this problem. Now, when something like this hits Time magazine, they're usually the last ones to know, right? But even they are saying, wow, there's an increase in cancers throughout the world that only occurred following the introduction of the COVID vaccines. But we don't have a clue as to why the cancers are on the rise. Kevin McKernan would disagree. The TGA stick to the claim that only 14 people have died due to the vaccines. In actual fact, over 1,000 people have been reported to have died due to the vaccines. And when you apply the usually accepted underreporting figure of 1 to 2%, we are looking at Australian deaths of 50 to 100,000 people. This is really quite serious. 35 people died on the same day. The otherwise healthy people died on the same day of their vaccination. And it is reported that none of them have been followed up in any credible way. So those 35 aren't even included in the 14. The chances of that happening is so close to zero, it doesn't matter. We knew the New South Wales hospital system recorded very, very well the number of people going to hospital who were vaccinated and unvaccinated until the end of 2022, when it looked like, you don't have to read these figures, but it looked like the overwhelming number of people in hospital were vaccinated. And the more you were vaccinated, the more chance you went to ICU or hospital. So what did the government in New South Wales do? What do you do if you're in government? You stop publishing the data. This is the data from the US. This is current. 39,000 reported deaths in the US. Underreporting factor of 1 to 2%, you're well over 1 million deaths. This is serious. There's been nothing like this before in history. It's easy to look at epidemiology and compare those that are vaccinated versus those that are unvaccinated and look at the death rates. They just don't want to do it. Prior to COVID, some vaccines were withdrawn with as few as 10 deaths. 10. A lot of drugs were withdrawn with 50 or 100 deaths. That was usually the benchmark. When there were red flags reported to drug agencies for a new drug, and they were reported as 50 or 100 deaths, it warranted an investigation. In the US, there's 39,000. Senator Ron Johnson, I don't know if you've seen him in recent times, he's uncovering why the US FDA is not claiming any more than 10 child deaths. It's outrageous. It needs an investigation. So in 1976, the swine flu virus killed, I say 32 people there. Sometimes it's reported as 50 people, but they withdrew that vaccine. It looks like, to me at least, that these COVID vaccines should never have been released. And they're still being given to people, and that should not be happening. This is, you don't have to read the details of this slide, but I'm just trying to make the point here that the scale-up manufacture of these COVID-19 vaccines was done so poorly, and the formulation was so complicated. I've never seen a more complicated pharmaceutical formulation in my life. And this was done in record time. It usually takes 8 to 10 years to develop a vaccine. If you look at the data very closely, if you know where to look, you can see that most of the serious adverse events and deaths are concentrated within 5 or 10% of the batches. The other 95 or 90% of the batches were suboptimal, subtherapeutic. The people weren't getting the full dose. Good luck to them. That's another problem. The claim that the industry still hangs on, this is their claim. We're all seeing amongst our friends, our family, the damage that's being done. It's in your face. You can see it with your own eyes. Yet the industry and the government still refer to between 3 and 20 million lives saved. This has been debunked so many times. It was based on modeling of mythical numbers. They assumed that the vaccine was really effective in preventing transmission, really effective in preventing serious adverse effects. They made so many assumptions that were not true. And they came up with this mythical number of 20 million lives saved. It doesn't have any credibility at all. I'll just turn my attention to the other vaccines in general. There's been a lot of discussion about this in recent times, and I'll just conclude with this, that there's been about 12 studies, various quality from time to time, that compared vaxxed to unvaxxed kids with childhood vaccines, not COVID vaccines. They all, to some degree, agree that unvaccinated kids are healthier. But there's one study that stands out a mile, and that is the inconvenient study that was done in the Henry Ford Hospital in Detroit. And it was released just recently. And it was well designed, based on 20,000 kids, roughly 18,000 vaccinated, 2,000 unvaccinated, and the results were astounding. It was the best quality study of its type ever to see the light of day. They tried to suppress it. It got out. They even made a documentary. If you haven't seen the documentary, I urge you to see it. It's called An Inconvenient Study. So I'll just conclude. The evidence is overwhelming. It is everywhere. You cannot ignore it. I'm just presenting to you the facts. And you might say, COVID is over. Not really, because this could happen again with another pandemic. If you understand the principles, if you understand where to look for information, you'll be vaccine educated and you'll be able to make up your own mind. You'll be able to have an informed decision, because I tell you what, you can't depend on your doctor to give you informed consent. Thank you for listening.
Hello, everyone. Hi there. Can you all hear me? Awesome. I'm Wendy Daniel, and I am so honoured to be in such distinguished company, both on the stage and our lovely team here, organisers, and you wonderful audience. So thank you so much for coming, everybody. And I have to trot through this one because I've got a lot to share. Let's see. I'm pointing it the wrong way. Right. I don't have a medical background, but I started researching vaccines 16 years ago when my first grandchild was born, and they're learning to drive now, so that's quite a long time. In my generation, as many of you may know, we had all the childhood infections. Oh dear, I'm not going to do that one. There we go, that's the book. We had all the childhood infections in school. One by one, nearly all of us in their time had measles, we had mumps, we had whooping cough all at the same time, and scarlet fever without any long-term ill effects. We had immunity for life, and we mothers, as many of you may know, had immunity to pass on to our babies in the first 12 months of life through the placenta and breast milk. So I had zero fear of any of those diseases when I started researching, and I never stopped researching. And this, as Tony said, is their 4th edition. It's so simple a 10-year-old can understand it. It has big text and lots of pictures, and it's all backed by the studies. And I also have another book, which I'm not going to talk about, called Detox After COVID and Thrive. The foundations of good health are always, they want to throw all sorts of things at us, but whatever they throw at us, these are the foundations of good health. It's always good sewage and water treatment, good housing, good plumbing, good heating, refrigeration, good hygiene, good nutritious organic food, exercise, fresh air and sunshine, and everything else is built on the top of that. And what I saw myself in this presentation, and Judy's going to expand on this later, is that vaccines have always been political. The reasons for vaccines are usually exaggerated or bogus. They usually made things worse. They were heavily protected by authorities. and the censorship is fierce. And this is the first. There we go. Vaccine. The first myth is vaccines stop deaths from disease. And in fact, improved living conditions stopped deaths from those diseases. And I've got two graphs here, and they both cover measles, scarlet fever, whooping cough, diphtheria, typhoid, which is from dirty water, and smallpox. And as you can see, let's see, let's use that one there. This up here, that's scarlet fever up there. All this is infrastructure. This is the engineers and the plumbers and all the infrastructure that goes in. And then this is 1838 to 1978. Right at the end here, we've got antibiotics, which are fantastic when you're at death's door, and vaccines coming right in there, right at the end, and to take all the credit. I don't know where no, I'm not going to do that one now. Oh, sorry, I've missed one here. Where are we? There we go. That's a similar graph for the US with the similar story here. Look, this is all the infrastructure here. We've got a bit of an uptick here with the diphtheria vaccine there, but the trajectory is the same. And down here, when it's all over, when the hard yards have been done, we've got whooping cough and measles vaccines. So that's the reality of it. That's really almost the whole story. So we're now going to we're not going to do that wonderful study here, and this is really like the original myth that people still talk about. Vaccines eradicated smallpox. In fact, improved living conditions eradicated smallpox. Edward Jenner pioneered vaccines from about 1796. Doctors of the day knew nothing of hygiene and went straight from sick beds and corpses to women giving birth without stopping to wash their hands. The midwives washed their hands, but the doctors didn't want to. And Jenner's favourite vaccination method was making 4 deep scratches in the arm here. My mother had those scratches, and rubbing diseased pus from a cow or a horse into it. He claimed success, and the procedure was often mandated, but there were no safety studies and many deaths. And this was mandated, so it was always political. Oh, that was little Mona Stevenson. She's a right mess. Vaccinated at 5 weeks old, and that's 5 weeks later. And then, oh gosh. Flipping over to polio there. It was always political, and because of that, because it was mandated, there were loads of pamphlets out at the time, and this is my favourite quote from many of them. Of all the many fads which have beset the medical profession, I know of none more hideous than rubbing the putrefying matter of a beast's disease into the blood of healthy human beings. Vaccination has never prevented smallpox, except by killing the patient before smallpox reached him. So, and all this came to a head in Leicester, England. Local authorities removed all mandates. Vaccination rates plummeted to around 5%. Those who did get smallpox were isolated and their home was thoroughly cleaned and disinfected. And this was known as the Leicester method and was a resounding success over 6 decades. They had far less cases and deaths. And Flintshire, for example, had 1 death in 276 people, and Leicester had, it depended on the years actually, but it was at the very minimum 1 death in nearly 500, and I think it was probably a lot more than that. And it's almost as if the vaccine was driving the disease with this thing. And to this day, that method is ignored by the medical industry, and yet I'm sure you can find statues to Edward Jenner somewhere. I've seen those around. And there we go. So now the next myth, of course, is polio, as many of you know. And the myth is vaccines eradicated polio. And the fact is that polio is usually, as many of us know, caused by toxicity. In the late 1800s, more and more toxic pesticides were being used to protect orchards, crops, and animals. Poliomyelitis is inflammation of the grey matter of the spinal cord by a whole variety of causes. Wild polio was little more than flu until a variety of arsenic-based pesticides were introduced in the late 1860s onwards. And the first documented cases of polio in Australia were in 1887. This really increased in the 1940s with the introduction of DDT. Oh, and there we go, DDT is good for me, hee hee. And they loved DDT. They sprayed it all over the place, as many of us know. These swimming pools, the kids are having great fun there, being sprayed with poison. Beaches, homes, they used it in wallpaper, they used it inside food cupboards, they sprayed it under clothes. In the jungle, the American soldiers had themselves like sprayed in DDT, and they got polio, and the indigenous people in, I think it was Malaysia, were fine. And farm animals like dairy cows were dipped in solutions of it, and the rise of polio tracks closely with the rise in use of pesticides and DDT. And even then, there were some fantastic, simple cures, remedies. Sister Kenny, an Aussie outback nurse, used heat packs and massage methods very successfully on paralysed limbs. And Dr. Fred Klenner here cured 100% of dozens of polio cases within a few days with intravenous high-dose vitamin C. And these simple solutions, again, were largely ignored by the medical industry. There's actually a film about Sister Kenny as well, that's what it's called. Meanwhile, according to vaccine scientist Maurice Hilleman, the vaccines were proving difficult. Grown on the ground-up kidneys of specially imported African green monkeys, neither the Salk nor Sabin labs could successfully kill off all the resulting contamination. The notorious SV40, which Philip mentioned, comes to us from this time. It was the 40th simian or monkey virus they found, and can still be seen in cancers today. And at the heart of all this, to me, is Dr. Bernice Eddy. She was a government health department scientist, and she was in charge of lab monkeys. And in 1954 was given samples of the new vaccines to test urgently. When she injected the monkeys, they quickly became paralyzed. She reported this to her bosses, but they ignored her completely and injected those same vaccines into millions of children anyway. And shortly after the launch of the vaccines, the medical industry altered the statistics to make it look to the public as if polio numbers had gone down. And as the polio numbers went down, diagnoses for a host of other similar diseases went up. Here we go, Guillain-Barré syndrome, acute flaccid paralysis, non-polio flaccid paralysis, transverse myelitis, Coxsackie virus, aseptic meningitis, and a host of other similar diagnoses went up. And to their credit, the US actually banned DDT in 1973. Right, next one. Vaccines save lives in Africa and India. And when I first did my first little book 10 years ago, I wondered if this might be true, but in fact it isn't true at all, because vaccines have cost lives in Africa and India. And these two graphs, there are two of them, are from Greg Beatty. So thank you very much, Greg Beatty. This is wonderful. Now, and what we're seeing here is, this line here is the, oh dear, I've got the wrong thing, wrong hand. Oh dear, what have I done there? Oh, it's skipped all over the place. Right, here we go. This one is the 5-year infant mortality. 5 years old. And this one is the 1-year infant mortality rate. And the time frame is 1960 to 2010. So it's really quite high here. There's 250 deaths per 1,000. Yeah, I think that's it. Yes, per 1,000. That's it. And here, this is the massive vaccine campaigns here. And there was DTP, diphtheria, tetanus pertussis, tetanus, measles, polio, tuberculosis in that time. And if those had been working, these lines here would have gone down like this. They would have, but they don't. Can you see that if anything, they've leveled off? That means that these vaccine campaigns weren't doing anything very much except slowing down the rate. There's Africa. Oh, and what I also did this week actually was have a look what they're like, because that's 2010. Let's see where they are now. Africa is now up here. 5-year infant death rate is up here. So they've gone way backwards since that. That's that line is now up there somewhere. Then we've got India. Very similar graph, look. There we go. And it's the same deal. Look, this is the 5-year infant death. It makes no difference at all. All those, this is a huge coverage of vaccines here. And India's done a bit better coming up to the present day. I hope you're following all this. Coming up to the present day, they've just gone up a little bit down here, but they're more than they were. So all of that has done nothing. If they'd focused on good water and sewerage systems, they would have been a lot better. Now then, on the ground, we've got Mogensen and Abe and the team. Peter Abe, in fact, went back to Guinea-Bissau in Africa a few years ago to check the results of the vaccine programs they'd done in good faith in the 80s. They'd actually done a perfect vaccinated versus vaccine-free sample in those days, or project in those days. And he was shocked to find that their vaccines had killed many of the children who received them shortly afterwards, and that the vaccine-free had fared much better. And the quote is, African children inoculated with the diphtheria, tetanus and pertussis vaccine during the early 80s had a 5 to 10 times greater mortality than their unvaccinated peers. And at the time when I wrote that, I had to go back to it and check it about 5 times because I kept not believing it. Right, next one. Now, this is a new one. Well, it's new to me anyway. Now, I hadn't done this before. So, because what this industry likes to do is scare people. And there's no doubt that this is scary. But it's not too scary. Meningitis, meningococcal and pneumococcal disease are a huge threat. And the fact is that these diseases are very rare and often preventable. Meningitis is a general term for inflammation of the brain and spinal cord. It's usually separated into meningococcal and pneumococcal, which are caused by separate bacteria. And sepsis, which is why the wonderful Paul Marrick is in there, is a big part of it. There's no doubt that these diseases are scary, but the main thing for most of us to remember is that symptoms can come on quickly and include high fever, headache, neck stiffness, sensitivity to light, nausea, confusion, and drowsiness. And if anyone's suffering like this, especially a child, of course, you just have to head straight to the nearest emergency department. Having said that, your chances of getting any of these infections are incredibly small. Australian figures show around 2,000 cases per year for all of them together, which is less than 1 in 11,000 people, which isn't bad odds, really. And there are about 60 deaths per year, which is around 1 in 460,000, which means that in Australia, you're way more likely to be struck by lightning. Risk factors include being a small child, probably crawling around on the floor, crowded conditions like daycare or dormitories, being indigenous, having a recent respiratory infection, or being immunocompromised. And I suspect that scrupulous cleanliness at these times and high levels of vitamin C are a crucial part of reducing risk factors at every stage. There are several vaccines which are said to prevent these diseases, but these are all tested for under 6 months with no placebo control. Placebo-controlled trials are not what they do. And Paul Marrick is one of the best emergency medicine doctors in the world. He was sacked a few times in the COVID years for speaking out, and he speaks about a cure for sepsis here, which is a part of this. We haven't seen a patient die of sepsis since we began using the vitamin C combination therapy, and that was quite a breakthrough for him. Right, next one. Here we have the wonderful Aaron Siri, and Aaron Siri is the one who interviewed Stanley Plotkin, who Philip spoke about before. And the myth is that vaccines are properly tested in official vaccinated versus vaccine-free studies. And the fact, as spoken by Aaron Siri, who goes up against these people all the time and wins, says not a single routine vaccine was licensed based on a long-term placebo-controlled trial, not one. There we go. And yes, if he says something, you bet he has the proof. He quotes a chart in here, and this is the chart. And of course, it's way too small for us to see. But this is, let's see this line here. This is the American schedule, and it's very similar to ours. And also, we use a lot of the same products, and we rely on them for our testing, as Malcolm Roberts, proved to us a couple of weeks ago, actually. But all we have to worry about is these two stripes here. This stripe is a placebo control. And now I'm guessing that you all know what a placebo control is. I'll just tell you anyway, just so that we don't miss anybody. If you're 7 years old and you're doing an experiment with two plants, one plant gets the water, that's the control, it's growing normally, and this plant doesn't get any water. And that's the experiment plant, so that you can tell the difference properly. But they don't do that. Every 7-year-old knows that, but they don't do that. So there's virtually no placebo controls, and when they do one, they're always fudged. And this is dengue fever here. We don't need to worry too much about dengue fever in Canberra. And this one is length of trial. And this one, of course, you're injecting this into healthy, tiny babies. So the trials should be 10 years and absolutely watertight, but they're not. Without a placebo control and less than 6 months. Some of them are days. As many of us know now. Right, next one. The flu, there we go. The flu shot prevents flu. And if you're not aware of any of this sort of thing, you can get surprised by these things. Suddenly the jab crew come in and there they are down the hallway and everybody else is going, and you can get sort of, surprised with it. Anyway, a study in 2012, children who were given seasonal influenza vaccines were 4 times more likely to suffer other acute respiratory illnesses. Then we've got, then how effective were the flu vaccines used during the 24-25 flu season? A study of 53,000 Cleveland Clinic employees. They would know everything about those guys. The vaccinated had 27% more flu cases than the vaccine-free. So I had noticed that even before I started studying this, that the flu, if you got the flu shot, you got flu. But there's more. This is a doozy. Right. huge UK database study among 13 million over 50s. A study links flu and pneumonia vaccines to a 38 to 50% increased risk of dementia and Alzheimer's. So it's just beyond belief. And that's a McCullough Foundation study that they've sort of looked at again. So it's absolutely spot on. Right, and then that's it. So, and the next one, oh, sorry, I'm not doing that one. SIDS is predominantly vaccine damage. I'm sure most people know that, but it is. But we're not going to talk about that. Vaccines don't cause autism, the grand finale. Missing autism is like missing a train wreck. It's absurd. And profound. And in the US, let's do this one. There we go. In the US, this is the McCullough Foundation report, which Philip touched on as well. In the US in 1970, autism affected around 1 in 100,000 children. In 2022, autism affects around 1 in 30. Oh dear, wrong. I've got the wrong hand. Oh gosh, there we go. There we go. It's 1 in 31. And down there, it was 1 in 10,000. The doctors didn't really know anything about it. Nobody knew what it was very much. But this is in the States. My guess is that we're a little bit behind that, but not very much. And over a quarter of them are profound. And this is just the most awful thing. It needs lifelong round-the-clock care, constant help with basic hygiene and dressing themselves and everything. They're often non-verbal and are likely to have a wide range of painful gastro problems. I won't go on any more about that, but there's all sorts involved in that. Anyway, so it's a very distinguished team looked at all these reports. They looked at around over 100 reports. And let's see, that's what Peter McCullough came up with, and that's far too complicated for us tonight, so I've simplified it for us. And here we have the main causes of autism spectrum disorder were found to be vaccines, of course, 50%. I think it's more than that anyway, but there we go. And then all of these are toxins. Here we've got pregnancy and drugs, medication. Pregnancy, drugs and medication in pregnancy. And that always used to be absolutely taboo, as some of you may remember. You never took anything because we remembered the thalidomide years. Then you've got maternal immune activation. Now, if injecting, vaccinating pregnant mothers isn't maternal immune activation, I don't know what is. And then here we've got environmental toxins, which could be all sorts of stuff. And these are the vulnerabilities. There's also older parents in there as well, which I haven't included, but maybe they're just more toxic parents. But here we've got genetic vulnerabilities. We do know that that's a point, and we've got premature birth as well, which it makes you more susceptible. So, and we're going to whip through some of these studies. You may have seen this if you've been around this subject, but here is our little unvaccinated kid here. Here's, this one is autism, it's 4.2 times, and here we've got allergies here. We're going to whip through these. Then this is when they started going after Dr. Paul Thomas's license here when he did this in his huge practice, as it was at the time. If you don't have any vaccines, you have 1 in 715 chance of autism. If you're on the CDC schedule at the time, it was 1 in 45. He really raised he had a target on his back from after he allowed that. This is the Hooker and Miller study. I really like this one. It's so tight and so clean. Not enormous studies, these, and they're usually, always independent. This is autism here, and we've got vaccine-free 0.4%, vaccinated 6.3%, and you can see how big all of these are. They're just, you know, we've got our usual suspects here: allergies, gastro issues, asthma, ADHD, and everything. Then we've got the control group study. This is it's a questionnaire, but it's very well respected. It's quoted quite a bit. And autism here, we've got 2.8% for the vaccinated, 0 for the vaccine-free. And then we've got a couple of a study from Florida. This is nearly 50,000 9-year-olds. So it's a huge study, huge database study. And we've got autism here at 1.1%. And vaccinated 2.8%. And then, and all the others, those are neurodevelopmental issues as a whole. Then we've got the preterm, the premature kids here, who seem to be more susceptible all round. And we've got vaccine-free 1.5%, vaccinated 4.7%. And then we've got the inconvenience study, so which you've heard about before. It is an amazing study. It really is. It sort of encapsulates the whole thing. So if you want to show somebody something, this is the study to go for, and you'll find it all over the place, Rumble and all sorts of places. And Philip did go over this, but I'll just say it anyway. Del Bigtree, who many of us know from the High Wire, had challenged author Dr. Marcus Servos to prove that vaccinated kids were healthier, and he took up the challenge. So this is 18,500 children from the Henry Ford Health, monitored from birth to 10 years old, and after 10 years, there were all sorts of other things, but after 10 years, 17% of the unvaccinated children had a chronic illness. That sounds a lot to me as well, but 57% of the vaccinated children had at least one chronic illness. Wouldn't you think you were maybe doing something wrong if that was the case? Anyway, I'm going to leave the last word to Nicholas Holscher, who is really the spokesperson from the McCullough Foundation. And he doesn't mince words, and in fact, Philip did touch on this as well. But there have been 12 vaccinated versus vaccine-free studies. We've gone over about half a dozen there anyway. And all 12 have found that the vaccinated have more chronic disease, more autoimmune issues, more neurological issues, more skin issues, more speech delays, more tics, and ADHD and autism. Everything under the sun. And those are his words. So, at the end of the day, the vaccine emperor has no clothes. But it's not quite the end of the story, because the cat is out of the bag now, and it is not going back in. So there we go. Thank you so much. Thank you.
Hello, and firstly I'd like to say thank you all for coming tonight. I can really only say either you're very curious people or you can think for yourselves. Because as you've seen recently particularly, the government, they're not trying to convince you with studies, right? They're telling you what to think, okay? And even in the government documents, it's not just the media. We're hippies, we're Fruit Loops, anti-vaxxers, conspiracy theorists. And when they can't do that, they associate the freedom movement, which are the people looking at mandatory drugs. You know, we're against mandatory drugs. So therefore, you'll see smear campaigns on the media, Spotlight, showing the freedom movement that is associated with anti-mandates. We're sovereign citizens, and then they smear the sovereign citizens, you know, or we're white supremacists, you know, and Proud Boys, neo-Nazis, right-wings. All of that is what the media says. And, well, here I am. I'm actually a science teacher. That was where, in the early 90s, I was teaching science in the schools. And I saw I didn't realise at the time, but I saw this increase in huge chronic illness. And what clicked for me was the principals saying, they were sitting around wondering what's causing all this chronic illness in children. So tonight you have been hearing about all the different studies. Right now, the government knows that you don't want to be analysing different studies and learning all this science. You know, they know that you can't determine the weight of evidence from these different studies. So they're not doing that. They're framing the debate for you. Vaccines are safe and effective. They've been tested for 10 years. We support immunisation. That is the mantra. That's what every parent got over the last 30 years when we presented to them the evidence of the increase in chronic illnesses in children. And that's what led me back to university. So what we're talking about is framing and these aren't my slides. Oh, sorry, that's... Right. So they're framing the debate for us, and they're using illusion. They've turned things upside down, and tonight I'm going to try and explain to you why you should be listening to the information provided by parents, right, and researchers, independent researchers, and some of the doctors that have woken up to this as well, as opposed to the government, whose advisory boards are now completely conflicted with industry interests. Over 50% of people on government advisory boards are receiving income from the industry, and if you look at the TGA, it's 98% of their funding comes from the TGA. From the pharmaceutical industry. So whose interests do you think they're protecting in public health policy? This is the thing. We have been told that the public health policies are for the community good and in our best interests. Well, the TGA admitted after COVID they don't have any duty of care to the public. But you weren't told that, were you? And so what can be protected in public health policy is both industry interests or the public's health, but you can't do both. But the TGA is responsible for both. They're responsible for approving the drugs and then monitoring the safety in the population. So do you think they have an incentive to monitor the health of the public when they're making profit from the drugs they approve? So in fact, they've never set up a proper surveillance system that will determine causal links with the vaccines. Now, I need to make a point here because we've had Dr. Philip Altman up today, and he's been a regulator for 40 years. He's only just discovered that because vaccines are classified, now vaccines are drugs, but they don't get tested in the same way as other normal drugs. And regulators didn't know that because they're classified under a different name. They're called biologics. A biologic, and if you ask what that definition is, they're told that you're told that they have organic material in them, biological material. Well, that's not exactly the case. The biologics refers to how they're manufactured. So even genetically engineered products, such as the COVID vaccines, can be called a biologic. Even the mRNA in the vaccine is not human mRNA, it is modified messenger RNA, genetically engineered. And that was allowed to be classified as a biologic and hence promoted to the public as a vaccine. But as you've heard from Dr. Philip Altman, it's a countermeasure and a genetically engineered product that's experimental. So tonight I want to try and explain to you, instead of comparing studies, I want to go through the principles of health promotion to try and show you why mandatory vaccination. So even if you think there's a role for some vaccines, which is fine, it's your choice with informed information, mandatory vaccines is not only harmful, it's unethical and unnecessary. And the government is only convincing you through framing and creating an illusion about these drugs. All right, so this slide, this is the precautionary principle. Now, if you're going to design a public health policy that protects public interest, the public health, then you need to ensure that you've tested the safety of that drug for over 10 years. The precautionary principle states the burden of proof of harmlessness of any procedure or technology is on the proponent and not the general public. So with this genetically engineered COVID vaccine, they needed to have tested it for at least 5 to 10 years to find out the long-term consequences, because many of these autoimmune diseases and cancer, they come out months and years later, 10, 15 years. So if you want to protect human health, you've got to test that drug for at least 5 to 10 years. The COVID vaccines, the genetically engineered mRNA injections, which aren't vaccines, were tested actually for 2 months. And after that 2 months, they ensured that the placebo group also got the injections, the vaccines, so that all of that data was wiped out. And Dr. Philip Altman showed you the deaths and illnesses that were produced during those trials. So it was only tested for 2 months, although they said it was 6 months. The data became available in December 2020, and it was promoted in 2021. So if you use this principle in reverse, which is what the government's doing, then you're protecting industry's interests, right? Because if the government's not proving that they're harmless before they promote them to the public, then you're protecting the profits that the industry is making from these drugs. So with respect to the precautionary principle, if it's not used in the right format in public health policy, then the government can ignore everything we're saying, right, and just tell you what is safe and effective, and then they use heuristics, rule of thumb, that's how the public is making their decisions on these vaccines, because you're deferring to the doctor. Right, so I'll explain that in my speech, but I would like to say that if I'm going to give you an overview of the principles of health promotion to show you why mandatory vaccination is against, is harming human health. And I will just quote Dr. Richard Harris, who was the Australian of the Year in 2019, and he did the rescues in the caves in Thailand. And he said, when there is uncertainty, people should be given all the information so they can make their own well-informed choices. That concept is at the core of living in a free world. So when drugs become mandatory in a population, that's your bodily autonomy, right? Quality of life. Once you've lost your quality of life, you've lost your freedom. And that's why this is so important. Next slide. Oh, sorry. Okay, so doctors must provide informed consent to vaccines without coercion, manipulation or pressure, right? That is the doctor's medical ethical guidelines. It's in their immunisation handbook. Doctors are all violating that with coercive vaccination that's been forced upon them by the government. But there's no jab, no pay and play. That's a federal policy. Doctors, as you saw there, it's the regulator APRA that is forcing them to violate their medical ethics, because if they speak of the risks of these particular drugs that are given to healthy people, they can be deregulated, deregistered. And many of them are in the courts at the moment, and they have been deregistered and others have committed suicide. These are the doctors trying to do the right thing, but the regulatory board, which is a corporate body, which is clearly protecting industry interests, right, is targeting doctors if they speak of the risks of vaccines. So coercion is against the ethical grid for health promotion, right? In health promotion, there are principles that you need, and one of them is that you don't coerce any medical intervention on a person, but particularly if they're healthy, because coercion results in stress and disease. Well-known fact. So again, that's a violation of their medical ethics. And here was Scott Morrison as the principal, as the Prime Minister, coercing the entire population with a genetically engineered, modified messenger RNA product. You can call it a gene therapy, but a therapy actually has some benefit. This doesn't have any benefit. Okay, now just a word on this policy, the no jab, no pay and play, right, that was put through social services. It's not a health, it wasn't put through the health department. And to put in mandatory policies, there's some rules. It needs to be for a legitimate public health purpose. Right? For the no jab, no pay and play, there was no increased risk of any of these childhood diseases in 2015 when that bill went through. Right? And the policy also has to be in proportion to the risk. Well, there was no extra risk. And it needs to be done in law, and that's health law. But Scott Morrison was in the Social Services Department in 2015, and he was the one that tabled the no jab, no pay. So this went through social services without any law in the Health Act, or any reason, legitimate reason for doing so. So the policy uses financial coercion for doctors and patients. Doctors actually receive an amount of money, a bonus money, for every vaccine that they give to children. Both are paid to promote and use vaccines. So money speaks. And if a doctor knows they're going to lose their job, they're paid to believe. And they want to believe. Now the problem is, are the doctors going into medicine for the right reason? And one doctor informed me that the majority aren't. So you might have 60 or 70% of doctors who are there for, the status and the money and being in the club, in which case they're just very determined to stay focused on what they're told in their pharmaceutical education. All right, so these are some of the problems we're dealing with. It's a breach of medical ethical guidelines to coerce people into this drug, because informed consent for vaccination it must be done without coercion, manipulation or pressure. That's the doctor's medical ethical guidelines. It's all violated. And it's a $15 billion profit-making organisation. So you can see why my work, they've heavily tried to censor me ever since I started my research. So getting on to the genetics of the population. We are all individually genetically diverse. You cannot mandate any drug in the population without killing and harming some people. And the point here is that the government doesn't test the drugs with a placebo before they're on the market, and the TGA doesn't have a surveillance system that will pick up causal relationships to tell us the type and number of adverse events that are happening to vaccines. This is how they're getting away with it. Deceptive surveillance and deceptive advisory boards with who's sitting on the conflicts of interest. So, genetics and the environment. Now, many of you will have heard from your doctors recently that some of these diseases are caused by genetics, right? Chronic illnesses are not, genetics is only part of the story. You might have a gene, but it can remain dormant until it is switched on by an environmental toxin. And that's what the doctors aren't telling you. This is a very, very solid area of science, epigenetics. And it's not good enough to tell you it's your genetics that's caused these diseases. That's an absolute fallacy. It is environmental factors switching on the genes that is causing the huge increase in autoimmune diseases and autism, speech delay, allergies, anaphylaxis. And in the past, we knew there was a family history involved, and doctors knew there were contraindications to a person getting one of these vaccines. That's why you went to your doctor, to see if you could have a vaccine in the old days. Choice in medications. So genetically diverse populations, the toxin in vaccines affect individuals differently. Okay, so it's not just your individual genetics that will mean that you react differently to someone else around you, but also the batches of vaccines. The batches are all different as well. And some of them will be more toxic than others. And there'll be contamination in the manufacturing process, right? And these things are injected into the bloodstream, right? So this is why, to protect human health, you can never mandate any drug in the population, and you need to know that a vaccine is a drug, right? And they're not drugs that are made only with organic molecules, right? They have toxins in them that are also active in the body. So chronic illnesses in children 0 to 14 years of age increased in a direct dose-response relationship to the increased use of vaccines from 1990. So whilst you've just heard of the studies of the vaccinated and unvaccinated groups, when governments don't do the appropriate scientific studies to give empirical evidence, you look at the ecological evidence in children. And children in all developed countries, over 50% of children now in every developed country has a chronic illness. Right? And that's what's been skyrocketing since the early 90s, as we started to increase the use of vaccines. Now that's a direct dose-response relationship, and under the Brad-Hill criteria for causality, that's your strongest evidence that it's the vaccines that's causing the chronic illness, because it's a direct dose response. But what will the government say if we point that out to them? Correlation doesn't equal causation, right? Now that's not science. If you're seeing a correlation, you must investigate it before you tell the public that's safe and effective. So once, as I said before, your fundamental right is your bodily autonomy. Without it, there's no freedom. You lose your quality of life and your enjoyment of life. And that's what people forgot when when this drug was promoted to them under the illusion of a vaccine. So epigenetics. This is a really interesting piece of information about allergies and anaphylaxis, which we saw skyrocket in the 90s, and all teachers needed an EpiPen by the end of the 90s. Charles Rickett won the Nobel Prize for discovering that vaccines were a causal effect for allergies and anaphylaxis. That was 1913. Right? And so it's not like the science isn't there. The science is already there. We know these things. But the government is listening to the lobbyists from the pharmaceutical companies because money is power and they have access to the politicians. So injection of foreign proteins, adjuvants, are known to cause autoimmune diseases. Right? How many of you have heard of people going to the doctor now and they're being told, the doctor's telling them, oh, we don't know what's causing your autoimmune disease. Well, a couple of years ago, these people got an injection of a modified messenger experimental RNA genetic product. So seizures, cancer, they've all been linked to the vaccines. Autism, which is encephalopathy, that's brain damage, right? Your brain, dysfunctional brain. So you've got mild or extreme, and that's why we have the spectrum. And it was virtually unknown prior to vaccination. And if you really wanted to find out, the government would look at the statistics of the number of autistic children that are vaccinated versus unvaccinated. But they say that's private medical information. But that's not a problem when they want to discriminate in the population, is it? During COVID, medical privacy went out the door. But will they look at the vaccination status and tell you the vaccination status of autistic children? Not a chance. Even when they frighten you with whooping cough epidemics, They're not telling you the true statistics of the fact that the cases were vaccinated. So all medical exemptions which are contraindications due to genetics have been removed in Australia since 2016. Now that was a political decision. When Scott Morrison tabled the No Jab, No Pay in Parliament, that bill removed contraindications. They're the genetic predisposition that people have to some of these diseases, called contraindications, and they were all removed, right? So that during COVID, nobody could get those exemptions. And when you know that vaccines cause allergies and anaphylaxis, these things are life-threatening. Heart attacks, strokes, they all went through the roof in young people, right? And turbo cancers, okay? These things have all been linked to the vaccines. So removing the contraindications, because we're a genetically diverse population, that's a breach of medical ethics. Your doctors are breaching medical ethics. Now, can I just say here, we're not having a go at doctors. Can I say that doctors are wonderful when you are sick, when you are ill, when you're injured. But this is preventative health we're talking about, right? Do drugs have a place in preventative health? No, because you saw from Wendy's presentation, these infectious diseases were controlled through environmental changes and lifestyle changes, and I'll get onto that in a minute. The serious risk was removed by 1950, right? So this is where the wool is being pulled over people's eyes. So now another thing, you're told that you must be responsible for the community good. And yet the government, this is from Terry Nolan, who was the chair of ATAGI for 10 years, and he stated, proving a drug can create herd immunity in the population is neither necessary nor sufficient for a positive recommendation of a vaccine for national immunisation program suitability. No drug is tested to see if it can produce herd immunity in the community. There's no proof of that. But guess what there is proof of? Natural immunity. Natural immunity was created when the serious risk of these diseases was removed. Parents weren't worried in the 50s and 60s of having their children get these diseases because the serious risk, that is hospitalisations and deaths, had been removed through hygiene, sanitation and nutrition and antibiotics, right? So they didn't worry about them getting the disease, and nor should you, because we're living in a developed country with all of those environmental conditions. And that's why you'll never get a pandemic. Public Health 101. Anyone who had studied the control of infectious diseases knew this was a pandemic right from the start. They used mathematical modelling to predict the scary risk of these viruses. None of that happened, and I'll get onto that in a minute. So, just a little bit of a timeline as to how we've arrived at this point. In 1986, the US Congress removed all liability for any drug that was marketed as a vaccine. You didn't have to prove it was a vaccine, you don't have to prove it creates herd immunity, you don't have to prove it's safe, and I'll give you another clue. They haven't even tested the childhood vaccines to see if they prevent the disease. That's the empirical evidence you need. What they use is a surrogate antibody titer, right? And so they'll show you some models of antibody titer. But if you look for the actual trial against an infectious disease to see if that modelling is true, you can't find it. It doesn't exist. And it was stated from the Swedish regulator that no childhood vaccine has been tested against the disease to see if it prevents the disease. Like they did with COVID, they didn't test it against COVID to see if it prevented it. That wasn't one of their trial criteria. Right, so it's illusion that they've been creating an illusion for a long time. So governments have claimed for 30 years that vaccines are proven to be safe and effective, and they are tested for 10 years. vaccine reactions are rare, 1 in a million. You see, if you don't report on them, they're rare. The media doesn't report on them because it's a corporate-sponsored media. Who's funding the media? You see, unfortunately, we do now have a medical industry complex, the government, the pharmaceutical companies and the media. Now, that's not a conspiracy theory, that's a conspiracy. And in my PhD, I've actually described how that works. And it goes back to the World Health Organization and international health policy, and that's how they control the health policies in every country. So governments are now getting directives from a centralised body, and that body itself is advised by the Gavi Alliance, the Global Alliance for Vaccines and Immunisation, which is the pharmaceutical companies. Right, so there's a big link there. So more and more vaccines have been added to the schedule based on these claims. But what if the claims are untrue? So if all those claims are untrue, they're not proven safe and effective, they're not tested for 10 years, we know that they're causing death and illness in the population. The only thing we don't know is what number, right? How many, but around us we're seeing it now with the COVID vaccines, and the childhood vaccines is a tragedy in itself. But that's how you create the illusion. They're saying one thing, but the opposite is actually true. So I did my PhD research in 2015, and of course the lobby groups tried to prevent it from being published on the website. But the university said they support my research because, of course, it had been internationally examined. What I found was the undone science in government vaccination policy, which is what we've told you about today. No placebos, no 10 years trial, and not even tested against the disease itself. And that is called undone science because it's the empirical evidence you need. What's happening is pharmaceutical companies are funding studies, but they're epidemiological studies. What that means is they can choose the parameters and that affects the outcome that they get. Okay, so, and then the government will say only use the recent studies, and then all the history of how we control vaccines goes right out the door. And that's what's happened. And also, they're not discussing natural immunity. There's other ways of getting immunity than a drug. And as you know, we haven't even got proof that these drugs can cause immunity. But we do know that we have natural immunity. And that's what Novak Djokovic knew he had when he came to Australia. And when he asked for his visa and it was provided to him, he did nothing wrong. And he'd had COVID, so he would have already had the antibodies and was protected with natural immunity. So he was detained for a thought crime. The fact that people might think he's anti-vaccination and therefore follow him. Imagine that. So this is where we're at. Anyway, instead of, when I was seeing all this information, I felt that other people needed to see it, so I started a newsletter, and that was in 2012. And it did end up going global. And I think that's probably one of the reasons why they couldn't just sift my PhD out the door when I finished it, because too many people were watching. And it's now been downloaded 38,000 times, which is an amazing achievement for a PhD. And I'm only saying that because it's information that they didn't want to get out, but I did write those letters, and yeah, it's now achieved 38,000 downloads. And then, of course, I lasted until October 2020 when I was deplatformed on MailChimp, because the CDC bought some shares in it in 2018, so I knew I was being monitored. But I finally put out a newsletter saying, that the cause of COVID-19 has not been provided, and letting everyone know that they hadn't actually systematically determined what was causing COVID-19 disease. So they were changing definitions and all sorts of things to convince you. So when I tried to debate my topic as a university academic, I got attacked by everybody, and my professor stated, "I have studied issues of intellectual freedom for many years. Never have I heard of a campaign against a research student more relentless and abusive than the one against Judy." So there's actually another book in the strategies that have been used to censor this information from the public. And a lot of ridicule and abuse was used, and lies in the media. Wikipedia. On my trip here today, I heard Richard, the fellow on comment, Richard Feidler, saying how independent Wikipedia was. And of course, my Wikipedia is locked, and it's been based on lies and often media articles and things like that. So please be careful with Wikipedia. So one of the big things that has also slotted into place for me, when this complaint of academic misconduct was made about my research in 2014 was the complaint, but my research had been completed in 2006, 8 years prior, on whooping cough. And the research had received a high distinction from the university lecturers. But all of a sudden, an anonymous complaint came in of academic misconduct. And of course, there was no academic misconduct even described in the complaint, and yet the university allowed that to be pushed through, and I had to be investigated through 2015. Well, what I've realised is it meant that my submission to the Senate inquiry into the No Jab No Pay in 2015, not a single politician could read it because of this complaint by an anonymous person of academic misconduct. And when I asked the university to put out a press release vindicating my research, because of course that complaint had been put through the media, for a whole cycle, for several days, the university refused. So this is what we're up against. It's corruption. I've also had corruption in the courts, just like Philip mentioned as well, other leaking of affidavits to the media. So this is all being controlled through derogatory name-calling, labelling, association, gaslighting of anybody who does get sick, and ostracism. Human nature is that you don't want to be ostracised or outside the mainstream, and that's what they're working on. They're not trying to convince you with studies, all these studies. You shouldn't need to do a PhD to actually know whether these drugs are safe and effective. And I'll just mention one other strategy that has been used. It came to my attention that in May 2025, Raina McIntyre, who took over as the director from the National Centre for Immunisation Research and Surveillance, that body was run by Peter McIntyre for 20 years. And that's the body that provides the evidence for safety and efficacy of these vaccines. So what she's done is she's put out a book and copied the title of my book, Vaccination. And the purpose of her book was to inform you of what is misinformation on this topic. Now, do you think that's not a conflict of interest? She's a government representative, and her job is to provide the science and evidence for the government's policies. Isn't that all on the website where you can all be convinced? And if a vaccine works, then we would see the benefits of those vaccines. Why does she have to write a book to tell you how to think and copy the title? Because the only purpose of this is to confuse the public about the claims of safety and efficacy. Do you see? You don't know which studies are right and which have been well designed and which haven't, and even the funding, you can't rely on that. So what they say to you is only get this information from a medical doctor. Rule of thumb. So you're not being convinced on evidence, you're being convinced through heuristics, framing, illusion, lies, and rule of thumb. And it's very effective. You will go to the doctor because there's no one else to rely on. You can't rely on anyone else. And we know that doctors are wonderful when you're injured or sick. But this is preventative health in healthy people. Drugs are not appropriate for preventative health, and they're not needed. The government only had this policy from the early 1800s, 1900s, because it didn't involve drugs to control the risk of infectious diseases. So let's have a little look at that. And don't forget that the doctor's education is sponsored by the vaccine manufacturers. They only know what they're told, right? And they're not told the ingredients of vaccines, and they're not taught the history of how we control these diseases. So when doctors are educated from industry-funded science, industry-funded conferences, just a little note there. After 2010, I applied to present my work at the Australian Immunisation Conference, and all 5 abstracts for university research were rejected without a reason. Now, what happens there is all the people that attend that conference only see one perspective. They don't realise that several other people who are trying to present different information, they've all been selected out. So that's how you get groupthink. And in the workplace, we now have groupthink because the people that thought for themselves and realised they wanted their bodily autonomy and their quality of life, so they refused to get an experimental drug. And don't worry, Greg Hunt told you it was experimental. He didn't hide that fact. Well, they left their work positions. So there's no one in the workforce, they're too frightened to speak up about the risks because they know they'll be ostracised or even deregistered if they're a doctor, and even told that they're mentally ill. That is also happening at the moment. So this creates an illusion of a consensus of the science because doctors are being paid to believe. Just to confirm that everything we have said tonight is real, this is the RICO law case that was established in January 2026 this year. So essentially, a RICO means the Racketeer, Influenced and Corrupt Organisations Act. And so we have the American Academy of Paediatrics, in collaboration with vaccine manufacturers, are being sued with a federal RICO lawsuit for vaccine safety fraud, right? So Aaron Siri and others, very prominent people, are involved in this case, and it is in the courts at the moment. But we've had success in the Supreme Court in the US before. Del Bigtree won his case proving that the HHS had not done a single safety study in 30 years since the 1986 Act had been put in place to remove liability. But do you know why it didn't have any effect in the population, why you people weren't angry about that? Because you didn't hear it, because the mainstream media won't report on it. Who here has heard of the RICO law case? No? Just 1 or 2. And that's because you're already into this research. So this is what's happening. When the media doesn't expose the corruption, it continues. And the only strength that we have is people power, and that's not going to work if most of you are still under the surface and not happy to promote this publicly in the workplace and in with your community. So the childhood vaccine schedule has been fully tested and proven safe. That's the claim that they're being sued about. And if you look at the charges, I've actually put the link there, but the charges also have recognised that the pharmaceutical companies are actually designing treatments for the diseases that they know are being created by vaccines. So that's one of the other charges. This business model has been going for a long time, and unless we get a media that's going to tell the majority of people, then we're not going to succeed. So that's racketeering. Now, just so you've got some idea of whose work I'm promoting, it's actually Macfarlane Burnett, who won the Nobel Prize in 1960 for his work in immunisation and the control of infectious diseases. And this is the information that doctors don't know about and that the government is preventing you hearing about by censoring everything that we're saying. So just as an overall picture of what's happening, this is a quote from Professor Fiona Stanley, who won the Australian of the Year in 2003. And she stated in her work that infectious deaths fell before widespread vaccination was implemented. And that was well known in the 50s and 60s. So the serious risk from vaccines was removed, the serious risk from infectious diseases was removed in 1950 in all developed countries, right? That's where you've got your sanitation and nutrition. Now, at that time, doctors did not need to report cases of measles, whooping cough, or flu. So what we're saying is there were still cases there. That's called infection. But people were not getting seriously sick from them and getting hospitalised or dying. Therefore, it was okay because you know what it was doing? Creating herd immunity through natural immunity. And that's why, as Wendy pointed out, you could go to school and the parents were quite happy for you to get the disease because it was either mild or, guess what? Asymptomatic. Subclinical. Do you know what that means? It means you're actually protected. It means you've had the infection without any symptoms, but you have immunity to that disease. And in COVID, the pharmaceutical companies reversed that in collaboration with the governments. The directive came from the World Health Organization. They reversed that and told you that an asymptomatic person was a risk to public health. Really? We've lived all this time on the earth and we've never thought of each other as a risk to our public health. And as you saw through Dr. Philip Altman's presentation, the PCR test was bogus. 45,000 cycle threshold was picking up things that didn't mean anything at all. So that's what happened. In all developed countries, infectious diseases were not considered a risk after 1950. Unfortunately, Fiona Stanley started to work for the Telthon Institute. That's the head of the snake, pharmaceutical funding, research, and she became the director. What I did was I got, in my PhD, I got quotes from all the top public health officials at the time. And this was from Lancaster, Australian, 1956. He said, as causes of infant mortality in Australia, all the infective diseases have been overcome by 1950. They knew that at that time the only cases were happening in the Indigenous communities in Australia because environmental and lifestyle and nutrition wasn't at the same level as in our communities. And this is the key factor. The context of these diseases has been removed as history has gone on. So, just to reiterate, please look at infectious diseases as infection, and then if you get a serious case of the disease, lots of symptoms, it can be serious, as in you might be hospitalised, or you might die from it. But in a developed country, that's very, very rare. And you know, when they told you that COVID was a new coronavirus, in actual fact, even if it was, coronaviruses caused the flu and colds. We had some natural immunity to it before, even if it had mutated. But in actual fact, this was a genetically engineered virus. So there's a lot of things that are not being told to the public, and there's a term for that. You're being educated to be ignorant. It's called agnotology. And by selecting out the data, that's what's happened. I'd just like to mention the case fatality rate, because also flu is only serious to the elderly people and occasionally to very young people, like infants under 2, if their environment's not right or if they've got constitutional problems. It's not a disease that the majority of people would ever be at risk of. So you don't have to worry about the flu. And that's what the case fatality rate is. You look at case fatality, you can't just say an infectious agent is going to be a risk to the entire population. It's usually demographics that are more at risk than others. So just to reiterate, history is being rewritten since 1950. They've allowed the vaccines to take the credit for the control, for the removal of serious risk from these diseases. So vaccines did not control infectious diseases. They weren't the major factor. Right? Some of them might have had some minor role in controlling them, so that's for you people to decide, and you should have that choice. What I'm talking about tonight is mandating these drugs in the population. That's the crime, and that's what was unlawful. Right? Herd immunity is a result of natural infection. There is no proof that any drug, pharmaceutical drug, can cause herd immunity. And as you saw, they don't even have to prove that to get them on the schedule. Vaccine reactions are not rare. The only thing we don't know is the number and type and frequency that they're occurring in the population. And vaccines do cause autism. Autism is dysfunction of the brain caused by encephalopathy, and everybody knows that vaccines can cause encephalopathy. In 1980, from 1980 to 1990 in Britain, they did the National Encephalopathy Study and proved a causal link, right? But in the early 90s, they reanalysed that study using different parameters and massaged out that link, then re-educated doctors to not believe that because at that time doctors knew that the whooping cough vaccine was causing brain damage, so they re-educated them to say that this vaccine doesn't cause brain damage, and they brought in the acellular vaccine so that doctors would promote that. And that's how they got away with it. But the whole cell whooping cough vaccine is known to be linked with brain damage. That was the 70s and 80s. So this is called ecological health or social medicine, right? It's not in the government's jurisdiction to mandate drugs in the population. Why are we bypassing the doctors and their medical ethics? We need to get angry about this. We need everybody needs to speak up, because human health is at risk, and we are changing the genetics of society with these policies. Just to clarify, because you'll notice that some people are now saying that viruses don't exist. What I will say is that the government and pharmaceutical companies are using viruses as an excuse for these adverse events that we're seeing in people. So often they'll blame a virus instead of the vaccine that you've recently had. What we do know is that germs will cause disease, but it's a balanced environment that prevents you getting sick. So the agent is necessary, but if your environmental conditions, your hygiene, sanitation, nutrition are good, and your constitution is strong and you're not stressed out, then all these viruses are around us all the time and you won't get sick, right? So it's the environment that makes the difference. But once there's stress or poor health and sanitation, then the agent will reproduce, and that's when the sickness starts, the germs. So Macfarlane Burnett's statement in 1952 was, genetics, nutrition, psychological, environmental factors may play a more important role in resistance to disease than the assumed benefits of vaccines. They were only assuming that the vaccines would be beneficial at that time. And what he said was, in the long term, universal vaccination may not be in the best interest of the race. Genetic deterioration of the population. And that's what we're seeing. Autism has skyrocketed, dysfunction of the brain damage. It didn't exist before the 1930s when we first trialled these things in the population. These are the sorts of chronic illnesses we're seeing in children. It's increased fivefold and even more now over the years. I thought I'd put this slide in because this has all been sleight of hand, changes of definitions. They'll use the word immunisation where they mean vaccination, right? Vaccination's the actual act of getting that injection. We don't know that it's going to give you immunity, but if they use the word immunity, then you're going to take the vaccine. So all of these things are deceptive. Imagine a vaccine so safe you have to be threatened to take it, right? Which was the COVID era. For a disease so deadly, you have to be tested to know you have it. Do you remember the queues of people lining up, no symptoms whatsoever, to get these PCR tests? That's where the cases came from, right? There was no real disease in the community. The only people that died were those in hospital, and that was by reversing protocols. You know, even remdesivir was a black triangle drug, experimental. The antivirals were provisional approval only. Mandatory government vaccination schedules are harming human health and cannot be called a health policy. This is deception. They're sickness policies, right? They're causing harm and death in the community. Look at the NDIS. You know, so much of it is autism. So the Therapeutic Goods Administration then claims it does not have a duty of care to the public. Are you prepared to take a drug that is injected into the body if the government doesn't have any duty of care to the public? Who knew that, you know? Isn't that why public health policies exist, for the community good? Right? Now, that's just one other point I want to finish up on, is that if we're genetically diverse, how can a drug be claimed to be for the community good? It's a fallacy. We've fallen for something that doesn't exist. It's sleight of hand. Right? So mandatory vaccination, right, is a crime against humanity. The public does not have to comply with the government policy that does not require the precautionary principle. These are untested drugs they're mandating on the people to be used to protect human health. And when the government has no duty of care to the public, mandating vaccination is an unlawful political, not a medical decision. The doctors haven't been involved, but they're promoting it because their medical ethical guidelines are being violated by their regulator, the corporate Australian Health Practitioners Regulatory Authority. So this is a crime against humanity, as most of you probably know. So all we can do is keep the education going. While ever the conversation's going, there is hope. So if I could just encourage you all to keep talking with your family and friends. If you know anybody that's about to have a baby, please could you direct them to the Inform Me series. There's the website. National and international experts have been asked to put together this series of webinars telling you, providing you with information on each of the vaccines and an overview of medical ethical guidelines and how the medical industry complex is working. All right, and also doctors, we now have doctors supporting us. So if you need any information to take to your own doctor to educate them, please go to that website, the Australian Medical Professional Society, AMPS, Doctors Lobbying for Patients' Rights. And they've written letters that you can actually take to your own doctor to inform them of the risks of particularly the COVID injections. Yeah. All right, thank you very much. And there's a question.
Thank you so much, Shatana. It was very interesting and very helpful. My name's Nuri Jan, and I've been involved with space for at least since 2020, if not from 2023. 2003. What I'm really interested in is how we can reframe conversations. So you've all said that we need to make change. We need to go back to our communities, and we all need to say and do something. Okay, mainstream media, the medical industrial complex has it down pat. You're an anti-vaxxer. We've debunked that. Whether you're saying, however you're saying, we've debunked that study. No one's listening to studies. It's sensitive effective. Don't you know that? I will not tell you. That's simple. That's effective. Do you know anyone in our space where you were beyond the alter, the simple words that we can go back and counter claim, or just be as confident to say the equivalent, but in our language? Do you have any idea? You have anybody that is verbal on that? Because I think we all go back and try and say, we try to read this book, you follow the list, and we just are sharing here. Go. Any comments on what your thoughts on that?
Yeah, just had a little comment. I had a little laugh then because during COVID, we did start to talk about people removing informed consent. Pricks. But I feel that labelling isn't the way to go. As you know, we've heard of normies, and that I don't think that going to that level is actually going to help us. And we know that the government's bringing in hate speech laws, and yet it's okay to call people looking at the risks of a drug, the risk-benefit of a drug, it's okay to label us as anti-vaxxers and conspiracy theorists when we're mainstream, university researchers. So this conversation does need to be had. When people talk to you of hate speech, bring up the word anti-vaxxer. That's bullying and name-calling, and I am actually blown away that politicians are getting away with this. I was in WA for 15 years, and McGowan called people drop kicks and morons if they didn't get vaccinated. So that's one thing we can do. The other thing I was thinking of is, A vaccine has created this illusion of a drug that has no side effects and is effective, right? That's what we have to target. Remind people, you're talking about a drug and you're talking about a healthy person. So the risk-benefit equation of giving a drug to a healthy person is much more significant than if it's a sick person and you've got to weigh up those risks and benefits. And in this case, let me just remind everyone that the recommended number of vaccines for infants now is 15 plus. From 0 to 14 years of age, but they're getting at least 12 of those in the first year of life. And that's what the No Jab, No Pay campaign by Murdoch Media News Corp didn't provide to the public. When they promoted that mandatory vaccination policy to you, it was just the No Jab, No Pay, and people were thinking 1 or 2 vaccines, unless they were parents, recently had a baby, and you're confronted with that schedule. So those are the things that I think you should target people with. A vaccine is a drug. All drugs have side effects. There's no place for drugs in preventative health. 15 drugs, and you're going to improve somebody's health, your baby's health, right? And remember, 50% of children now have a chronic illness, right? The reason that if those kids were dying, then that statistic would be obvious. But because you can look at a group of children and not know that, and because the media won't report on that, then it's hidden. And that's why the pharmaceutical companies are getting away with it. And please don't forget that the symptoms come out months and years later. That's another reason why they're getting away with it. Yeah.
And also, you are sitting here, and I suspect a lot of you are thinking, gee, you're just a small group that great wash out there don't really know what's going on, right? Don't be fooled. More people are awake than you might realize. One of the clues is this with the sharing price of Pfizer and Moderna, and even our own CSL, Commonwealth Serum Mass, which is one of the biggest vaccine manufacturers in the world. They all suffered that really heavily. Because more and more people are becoming aware of the issues. So don't think that we're up against the biggest industry in the world. We have the oil, yes. This is huge. And they control the politicians. And they control the medicine. And I didn't realize that until very, very late. I'm sorry about that. I do apologize. But I'm awake now.
Just quickly, I think that we have to tackle this one person at a time, really, one little family at a time, and try and, where possible, many people vying. This is why I wrote the book. Precisely why I wrote the book. And the more people there are in the group, like if you're buying for your kids or something, that make sure that they get it, their friends want. So, but at least you've got a chance. And once you've handed over a book like that, you've got the whole story for them to look at when they want to, in their own time. And apart from that, you can't control what they do. And in fact, Barbara O'Neill had a very good little quote. She said, when you hand over any book, and they do actually sell my book, you say, tell me what you think, which means it's a little invitation. And in fact, one more thing there about that's it that Mike picked up on. I like the term vaccine educated. I don't repeat insults about me and I don't give them any time. So I'm vaccine educated, and that means that, like, if you're an anti-vaxxer, you're banging your head against this citadel of knowledge, this fortress of knowledge, and I don't think that's where we are anymore. We probably were 10 years ago when I started, but we're not there now. And when you say vaccine educated or vaccine aware, that puts you front and centre and above, like this. That I know more than you about this, and it changes. It's like it sort of takes them aback. But at the end of the day, you can't control what other people do or choose. But once you pass that information on in whatever form it takes, then your conscience is clear. So,
I love it. I love it to vaccine, or vaccine, it's brilliant. Uksen a lot of people today, right, Mrs. and Rube now. But one of the things I'm interested in, I guess on podcast, they talked about just the insects. If you read the inserts on a lot of education, contraindications, adverse effects, all those things, are there inserts to vaccinations, and can you ask to those when we...
Yes, there are inserts of vaccinations, except the COVID vaccine. I think you'd all be aware it was blank. They didn't even pretend that they'd tested it properly. But the product information definitely for each vaccine, and it's very informative. Yeah.
Oh.
Yeah.
I believe that the ADN has the vaccine sets. Is that on their website? Now, for me personally, certainly when I started, and even now, I didn't go by the inserts, because to me, to say that to an everyday person is like telling them, oh, well, you go and find this thing that's written in a foreign language where you don't really sure where to get it from, and it's written in language that you don't understand, and you don't know what the ingredients are and all this. To me, it was too complicated for a long time, and I personally, and I know these people are very well, versed in the studies, but I don't think it's the place to tell anybody who's an everyday person like myself. And that's exactly again why my book is so cynical, that I've tried to boil it down as best I can into a framework that people can understand, and yet they can look at the studies if they want to, because it's all linked.
The product information, that's capital P, capital I, is a word negotiated with the teacher by the sponsor, that's the company that owns the product, is such a technical document that really it would be next to useless to you to have a read. Except that in spots it might say no testing done for general toxicity or use of transiency, and not approved for use in sugar. You might pick key things out there. But in general, no. What the industry has done is they sanitized that, and they published a patient information leaflet, which is sanitized, which myself couldn't give it out yet. So this is the problem. If the TGA in this country and the US FDA cannot be trusted to tell you the truth, where they go? And if you can't go to your doctor and get true informed consent, the whole system is broken. This is why I became very concerned when the provisional approval system was introduced. That was, in the beginning, supposed to be used rarely for severe life-threatening conditions, not for healthy people with a gene-based scar that had to be tested for 2 months. That's crazy. But it's an example of give them an itch and they take a mind. And now, 1/3 of the new drugs that are put on the market now are provisionally approved. This is wonderful for Big Pharma. At least they can get their drugs on the market much quicker. And all you have to do is go back current goal on the product information and show stock it's in date. No one knows it. They don't know what it means.
Wow.
And if a mother comes in and their son has heart pains, looks like myocarditis, says that occurred just after the vaccination, the doctor says, oh, no, it's nothing to do with vaccination. He does not know what that black triangle is. That black triangle means he or she must report that. How many of them do? They don't. The whole system is broken. And we don't have endless time to become many pharmacologists. I mean, who do we depend on? It's really hard.
I just wanted to add to that, just that you might have noticed that the government has recently redefined vaccine. And what it means is that more drugs, more different types of drugs can now be put on the market as a biologic, which means that they're tested in a different way to what drug regulators like Philip have been doing for 40 years. Once it's classified as a biologic, and as I mentioned before, biologic does not mean that it has to have organic material in it. It's genetically engineered drugs can be put in that category. Yeah. Yeah.
Good evening, Richard Owen is my name. I want to thank all of the speakers for filling in a lot of gaps in the knowledge that I had, although I think I've tried hard to be what they call the gaps. I have two questions, or many questions, but I don't know if I could have two questions I'd like to ask you. Could you just jot a memory on the promotional literature for this severe? I think it was a reference to encouraging people from the media to kind of put questions, to ask questions to see. I think I'm right in saying that.
Oh, on the flyers? Yeah, we did. We invited health professionals. No. I'll also point out that politicians, we invite politicians, but in the past we've even invited the Health Minister and Fiona Stanley, and we've had to leave a seat out the front with their name on it because they won't come. Yeah.
Richard, I've been speaking public at DG well now. We communicate a lot. On this issue, I've lots of podcasts, and my Substack goes everywhere, though I was locked down with my Substack this morning. No one, despite my offers, wants to debate Lowbert. Here, I'm not a young guy. I've been retired for a number of years, and thought would be easy to push forward. So, those come forward.
I think Steve Kirsch in the States has offered $1 million, but
Yeah, the one thing that you notice is that there's no debate. No public debate. Doesn't that tell you something? If they were right, then it'd be right here and then be crushing us. Carry on.
Philip, can I just, I should let you know that in 2015, when the No Jab No Pay was going through the federal parliament, a media student came to me and said, would I participate in a public forum debating, the social services ministers and the Peter McIntyre, so government people. We wanted a public forum to debate the topic so that they could provide the evidence for a mandatory policy. We asked 45 doctors, health authorities, as I said, Scott Morrison, who was tabling the bill, and Susan Ley was the health minister at the time. They were all invited. Peter McIntyre, Robert Bowie, who you still see in the press. None of them would come to this public forum, so we held it anyway. Because parents wanted to know. This was a parent of 3 children. I've got the film on my website. We filmed it. I was supported by a naturopath who came and presented information as well, and we presented the government side from the publicly available evidence, and we debated, and we still held the public forum, but not a single one would come to this forum pre that policy being introduced. Yeah.
The mandatory benefits for everybody are limited to one thing that I think is quite important here is the way the language we use. Because language can empower and disempower, depending on the same words can empower and disempower, depending on how to use. I wondered if you could, the three of you, clarify for me. You actually mentioned, you referred for doctors giving informed consent. We hear this time and time again, doctors doctors should give informed consent. I always thought it was the patient that had to give informed consent. And when reference is made to the doctor has to give you informed consent, to me that risks disempower, using that expression risks disempower the patient, because if the patient knows that it's up to him, he has the power. No, I don't see. When it's described as the dog giving informed consent, the patient sort of like, what can I do?
No. We have to define what we mean here. The doctor is required to inform the patient about the risks and benefits of the vaccines without coercion, manipulation or pressure. That's their requirement. That's what they're required to do. It's the patient that needs to give consent, but they're not allowed, to give consent, you've got to have all the information given to them. But what we're saying here is that the regulator now is preventing doctors talking of the risks of vaccine, because that's anti-vaccination, didn't you know?
Reading these to be clarified.
Yeah, so that's right. Medical ethics from the World Medical Association requires that all doctors provide both the risks and benefits of a drug to the patient, and any alternative to that treatment should be provided to them as well. And that's what we mean by informed consent. The patient can then consent to that intervention based on information provided to them. Yeah.
Okay, to run out of time, was only out one person speaking. So, one speaker will answer your question, and I'll take 2 more questions after this dinner.
Okay, what goes to Bagal, and you wish the inconvenient stay, and it seemed very good, very bold with it, almost sorry. However, then presented to family members, and they go to collect their LPs the internet. They said, got this versus the box up proves headed by statistics at the University of Pennsylvania. It goes on, and then you come up with what seems to be very they people go about box. Doesn't matter. So that's a huge issue that the audience is asking, how do we get the shares? So here it's saying that the problem is, it's just one paragraph, that 25% of unvaccinated children in the study were tracked until they were less than 6 months of age, 50% until they were less than 15 months old, or 25% tracked at age 3. Whereas the vaccinated kids, they were 75% were followed past the age of 15 months, and 35% were 5.78. So it's saying that these diseases don't come up until these kids are older. And so therefore the study was seriously body uses how you really doing. So what's your thoughts on that? Are the general causes slight correction of so-called misinformation?
You not a position to drill down on the in the study. So all I can tell you, because I don't have that data in front of me now, all I can tell you is that Zervalos he was the senior investigator for that study. And who designed that study was a pro-vaccine advocate. And it was one of the biggest studies ever done. And it wasn't criticized when the report came out. So what you might be seeing is a typical hornet industry pusher. They have enormous resources. Anything that comes out that is not in their interests, they are the loss. I can't speak to the numbers. I can tell you, okay.
I actually had this in the speech, so I think I read it out. Anyway, he actually, and they wouldn't have done a documentary on anything that wasn't sound. They would have absolutely had it tied up. He himself said it was a sound study, and they followed 18,500 children from Henry Hoard monitored from birth to 10 years old. And what you are seeing there is evidence of what we've all said, that they're less than honest, shall we say, about what they do. So it was 10 years. Right.
Mm-hmm. Well, got a question here. You heard this 3 years ago that World Health Organization is trying to be sectors viewed as past with governments in the world, where a pandemic could be declared in 70 hours, and where in this case, World Health Organization will take over the customs and quarantine that country, and will manage health academics in that country. And we heard that Australia, I'm not sure if it had signed already or we're part of it. Are we protected? Are we prepared for that, for what comes next? Especially when it comes to the World Health Organization level. I've got another one because after you want to answer. Do we know if Sputnik or Sinovac, China, Russia have similar kind of conspiracy as well as the people? Just on the
Just with the World Health Organization and pandemic treaties, they're trying to now change the treaty. When COVID hit, the pandemic plans were not binding for each country, but because money was driving it and the responsibility was given to the Prime Minister of each country, that meant that most countries didn't use their already existing pandemic plans. They listened to directives from the World Health Organization, which of course were all the opposite to how we should have controlled the disease if there had been a real pandemic. But now they're going to make them binding. And no, Australia is still will still sign up to that. I believe it's been postponed, so there is still more time for people to keep talking and to ensure that people know that the next time something hits, this will be binding, which means that, all of these measures will be enforced.
The key information about demaking counteraction came from Kevin Kern. I heard or understand that Port Hedland Council wrote a letter to every council in Australia saying, how are you looking after your constituents with this information? Would it help if we were sending letters to our own council who were saying, what are you doing that protecting us because of all this information here?
I think all of that does help. Yeah, personally, the more letters that you can send in, the better. It's the only way to keep the conversation happening. What do you think?
It's very technical, boils down to a technical idea. The mere fact they used SB40 in their production is a real red flag. It's known to produce cancer. Russell Broadbent, the MP from Monash, Victoria, raised some hot. He wrote 2 letters to the Con Minister referring to the occurrence order. It was co-signed by the 50 medical and other scientists, including myself. It had no response.
Yeah, I'll just finish that off just by saying if you're not using the precautionary principle and testing these drugs first, then that's why the government can ignore everything we provide to them. They just ignore it because they don't have to look at it. So this is where our problem is. They've reversed the precautionary principle in these policies.
So they drive around Australia, you're Australia, you're trying to make a country out. And what I'm saying is, I want to do people. My question is, once they're tanking it, is this the person?
Well, there's a book back there which I wrote in conjunction with 4 Australian naturopaths and a homeopath, which is a detox after COVID and Thrive. And that is, it's a great start. I now know it's not the whole story. There's another book really that's coming up, but it's a fantastic start, and it's a great start for somebody who might have been mainstream compliant before, and it's very simple and backed by these naturopaths. It gives people real recipes, if you like, for them to follow for themselves and leads them through.
They're not getting up.
Sorry?
They're not getting any help.
Oh, look, all that this, that's the best I can do. I can't go around helping everybody, but once they've got that, they can order that from there, and you can buy one and show it to them. But it gives them a roadmap of what to follow and who to go to, because you can't go back to the doctor who stuck you with that thing in the first place. You have to find somebody else, and it tells you when you're probably okay to try, to do something yourself, and when to look for a practitioner and what to look for.
Sorry, this is the last question, but before I hand over this lady, I want to thank everyone that has come here tonight. It has been a challenge doing this event in Canberra. It's an unusual post of beloved Papuan and at Vaccination label. So I just want to thank you all. It's as incredible as you can see, and I hope you learn something. Going to start in that honestly 30 minutes, 4 minutes. If one person answer, because we've really got to be out here by 10 o'clock on the dot, and we want to have some book sales as well. So I'm handing it over. Thank you, everyone, and let's come. Thank you very much. I'm not hard to. I absolutely don't want to pursue you guys, and I'm really not going to cook you often. I am diagnosed as vaccine injured, whole body vaccine injured actually by the Pfizer. I was no meal stuff. There is no help out there, but I am happy to talk to anyone who may have friends or family who may be a doctor. I support a doctor who's Libyan. And I do take low dose naltrexone, which has given me a lot of my life back. I couldn't be able to walk to my kitchen. I couldn't function at all. Things like that. But I just want to take, I did turn up with and Sanbo, I think they might have immunocompromised now or associations for everything I have in a chat.
Yes.